Hello everyone. I shall be describing our video titled Conventional Wisdom for Radical Ideas, where I shall describe our experience with a repeat retinal autologous transplant after the primary graft dislocated upon using fibrin glue. An autologous retinal transplant was first performed for a refractory macular hole with foveoschisis, while we performed our first such procedure for a giant traumatic macular hole. A host site was chosen superior to the disc, lasered, and the graft was excised with scissors. The graft was then placed on the macular hole under the cover of PFCL and positioned bimanually. Patient had a good outcome with 20/50 visual acuity 6 years after the surgery. Our case concerns a 74-year-old gentleman who presented with a refractory macular hole to us. A graft site was chosen infratemporally and barrage laser was done, and the retinal graft was then gently excised with the help of curved Alcon scissors. We then switched to bimanual maneuvers and, with chandelier illumination, completely excised the graft under the cover of PFCL, while ensuring that the current orientation of the retinal layers was maintained. The graft was then delicately positioned correctly with ILM forceps and fluid air exchange was performed. After a complete air fill, fibrin glue and thrombin was injected to form a fibrin coagulum. The patient had an attached retina and fibrin coagulum at the macular site on the next day. 1 week after the surgery, however, we discovered that the graft had dislocated and patient was taken up for repeat surgery. We first checked for the dislocated graft, which was discovered in the infratemporal vitreous base. As we can see, the graft is now white, opaque, and undergoing ischemic necrosis. A new donor site was chosen infranasal to the optic disc, and an appropriate graft site was checked by diathermy. The donor site was well lasered, and the graft was excised bimanually under chandelier illumination and positioned at the macular hole under PFCL cover. A complete fluid air exchange was performed, and this time we went the conventional route and injected 1000 centistoke silicone oil. One week after the surgery, the retina was attached, both donor sites well lasered, and as we can see clinically and on the OCT, with graft in situ at the macular hole. The patient's distant vision acuity improved to 20/200.